I'm here to present the ProMMise clinical trial, which is a phase 1/2 clinical study evaluating the role of Belantamab mafodotin, a BCMA-targeted antibody-drug conjugate, in combination with other therapies. And this is cohort B, which is combining oral cyclophosphamide and dexamethasone. We chose that because cyclophosphamide can deplete T-cell regulatory components, which can add to the immunogenicity effect, which is also observed with Belantamab mafodotin, but also because it's a cheap oral available agent which is widespread usable across the globe. So in this phase 1 study, we looked at 2 different dose levels of Belantamab, starting at 1.9 milligrams per kilogram, escalating to 2.5 milligrams per kilogram. And importantly, we were giving this every 8 weeks. And what we found is that the response rate at 1.9 was 88%, and at 2.5 the response rate drops a little bit. Now, when we look at the toxicity profile, what was very interesting was that patients were more likely to achieve their dosing with Belantamab and cyclophosphamide at the lower Belantamab level, whereas patients were more likely to have dose delays or dose interruptions at the higher Belantamab. So that may potentially lead into the higher response rate that we were observing. So overall, what we're demonstrating is that you can deliver Belantamab plus cyclophosphamide and dexamethasone for patients with relapsed multiple myeloma. Importantly, you can use the Q8 schedule, so that's quite convenient for patients, particularly with an oral partner, so patients aren't coming to hospital very frequently. And the lower dose of Belantamab is associated with a higher response rate and a better tolerability profile.